little star on there. I don't know how
There
they
you
have it.
go.
Hi, Michelle. Hi, Cindy.
Right.
Okay,
At
there we
least
go.
See
I'm going to
anybody
change
in
it.
YouTube yet? YouTube
I,
land.
I just had to start it. Okay, now we're good. So we're going to be talking about passing a pre-employment coding exam today. Alicia,
And what to take on a job interview.
Right.
So I'm just curious, everybody that's watching, how many of you have actually had the opportunity to take a coding pre-employment exam? I have, and I assume, Lauren, have you ever had to do that, or have you always been?
Not a coding one, no, because
Yeah.
most of my work, actually, that's not true. I did have to take one for the coding network. I had to prove that I could do radiology coding, but it was, I got to do it at home and then hand it in. It wasn't like I had to go to an office and sit there and take it while they watch, you know.
Yeah. Yeah.
But
That's
it's all
another point.
stressful.
Let us know if you did take a pre-employment coding exam, if it was one that you went to the office and then they gave you the paperwork and you took it online at the place of employment, or if they sent it to you, because I took one at a hospital once and I was not a very good coder at the time. It was pre-certification. And then the next time I took one, it was remote. It was from a remote job, and they sent it to me. And the first time, it was a hard one. It was inpatient coding. I knew very little about it at all, and I really, really struggled. And this was a long time ago. And then the one that I did remote, though, was for risk adjustment, and it was super, super simple. In fact, some of the questions were questions that I had actually used as my own tests at the college.
Wow.
So I think they had just
You know where
acquired
they're
them from
getting
a
it
test
from.
bank of some kind. Yeah. So that's interesting. Todd says he's done online and in person. Okay. And Michelle said that worked up the ranks, right? So you were already established. That's all on Facebook. I'm not seeing anything in YouTube yet, but so this was a question that we saw on social media quite a bit through the CCO's social media. And that's why I thought it would be a really, really good question to go over, because if you know what to expect, just alleviating that fear is half the problem. Don't you think,
Half the
Laureen?
battle.
I mean,
Half the battle, yep.
half the battle. Yeah, yeah. Because it's almost like taking the exams. You know, if you've taken practice exams, you know what to expect. You've alleviated that fear a little bit.
Yeah.
But
I know in reading some other forum posts, people were asking, do I bring my manuals to, you know, if they don't tell you that ahead, I would bring it just to show you're prepared, you know. And then if you do the bat technique to your manuals and they see that, they'll be like, what is this? And you can tell them all about that, and they'll be like, this is one prepared coder. So I would bring your manuals just in case. They might want you to demonstrate that you can use their encoder, because chances are if they're sophisticated enough or they're having you take a test, they probably have an encoder that they use in their practice, and they want to see how proficient you are at using it. And most of them are pretty intuitive, but you can ask ahead. Say, will I be using paper manuals? Should I bring my own? You know, I'd find that out ahead.
I like what you said about having them see that you've got notes and stuff like that, because that really shows diligence. I mean, that we all write notes in our manuals and things, but especially if you're a new coder and they see that, that's going to right there give you had that first impression. You know, they talk about first impressions for them, somebody to see that. And don't ever take for granted who sees you or observes you, because they may be the one reporting back. You know, if they see, you know, say, hey, yeah, I saw her do that pre-employment exam. Yeah, maybe it took her longer than maybe some other people, but did you see her manuals? You know, hey, you know, and so that would be a good thing. So what to expect on a paper exam? It's going to be like fill in the blank type thing. They're probably going to give you not more than maybe 10 or 20 questions, honestly. They don't want you to spend very much time. I would think 20 minutes to 30 minutes max is what they're expecting you to spend time on if you're in person and they hand you a paper.
Yeah, they're trying to screen.
Right. They want to know if you
can.
They'll probably, like Lorraine said, they'll have a guest thing where you can use their encoder. That's another reason why I really like Find a Code and having you have the opportunity to experience an encoder before you get a job.
Yeah.
Or even people that are on the CCO club, being able to navigate a platform. You'd be surprised, even though we're used to Podio because that's the platform we use every day, but new people kind of are leery about it. But being able to go from one platform to another is a skill set that you would be able to show them and show that you're comfortable doing that. So if they don't give you a paper exam, and let's say they set you down at a desk and they have an online exam, again, you're never going to get a multiple choice exam like you would for certification. It's always going to be fill in the blank. Something that Laureen and I were talking about ahead of time, paper exam and sometimes both. If it's online, they'll leave comment stuff. I think it's a good idea to kind of put your thought process. If it's one that you just is not you struggle over it a little bit, tell them why you picked the code you did. Because then they may say, well, that's not the right code, but I read what you said. Can you explain why you thought that? And then you could share an experience. Were you going to say something, Laureen?
I said, and that's sharing your thought process. And it's very similar to why we have doctors document, their plan of care. And, it's all to understand what was going on in their head. Why did you order that med? Why did you order that test? So if you can at least explain where you're coming from, and that's true with audits, if you get audited and they don't agree with your coding, you can, as long as you can defend yourself, that's really the key.
I think that's another thing we talked about, that before you take the exam, you might mention to them and say, well, we have time, will we be allowed to discuss it afterwards? Because they may say no, or they may say, yes, would you like to? It's like, yeah, I kind of like to use it as a learning opportunity. And if there's something that I, didn't code correctly, I want to know what I did wrong. And I think that would be a good way to phrase it too. But some may not. Let's talk about now if you're taking one remote. With a remote, it's going to, of course, be a little bit different. And the couple ways that they could do that. They could send you a document, but probably will not be that format because they don't want their pre-employment exam getting out. Right. So they may set it up with a passcode or something to where, they can track that. But with that type of a document, you can usually write things in the email when you send it back. You don't have to be super savvy with the IT stuff, but again, being able to use that platform, if they're sending you a remote pre-employment exam, it's probably a remote job. So you want to let them see that you're comfortable with that format. The soft skills are different with remote jobs than they are face-to-face, right? But there's still soft skills involved. And so be careful with that. Again, it'll be fill in the blank. So you'll be responsible to know, hey, am I going to be coding CPT and ICD? Am I going to be doing inpatient where I'm going to be doing ICD, CM and PCS? Do you want HCPCS codes in there? What code sets do you want me to use? And of course, like Laureen said, radiology, if it was something, maybe you didn't.
Specialties.
Well,
if it's specialty specific, like the coding network back in the day, I'm sure it's still that way. They hire coders to code specific specialties. Someone might be proficient at more than one specialty, but normally they have a need for OBGYN coders or cardiology coders or, you know, VIR coders. So they will give you a test for that specialty. And they'll even, actually, is that the one I'm thinking of? I'm thinking of the other company that created Practicode initially. Anyway, you know, that's how these online coding companies work, is they want to get you proficient at that specialty, because if you only have to work on one specialty, you're going to get really fast versus having to handle coding anything thrown at you. So they want to see that you know that specialty before they put you on it. And then of course they do, you know, an audit initially until your work is good enough to just kind of let everything you do go through.
Yeah. That is another thing to not be nervous about. You know, it's not like they expect you to be perfect. Even if you are an established, well-rounded coder and you go into a new position, they're going to audit you. I mean, it's a way of life. Every coder gets audited for a very long time until, because like I said, it's a new platform, it's a new area. People have policies and procedures. But the one thing you have to know about taking a pre-employment exam. Actually, there's two things. There's two ways that they're probably going to look at it. They're just going to go find a bunch of questions. This is not easy to do for them. Well, you know, they probably have one pre-employment exam they've been using for the last 10 years. You know, it's not likely that, you know, it's fresh and new unless they've had some major changes and stuff happen. You'll be able to recognize it pretty quickly if this is something that's older or if this is something that's newer that they're using. The other thing, again, and it could either, you know, face-to-face on a computer or remote. It could be that way. I can't remember if I shared with Laureen or with you, but yeah, because we talked before we come on here that the one remote one were questions I had seen before, but every single one of them are going to be heavily covering guidelines. It's the guidelines that, you know, it's just like taking the certification exam. It's, if you know the guidelines, every question that's ever written to test somebody is usually to say, hey, I want to know if you know this, and it's guideline driven. Even a specialty exam for radiology or cardiology or anesthesia, it's going to have something that they have to maintain for reimbursement purposes usually. You know, so keep that in mind. If you know the guidelines, or look at the question and say, what do they want to know? I don't know, or if I do know, and it probably has something to do with a guideline. The people that probably do really, really well are ones who just passed a certification exam.
Yeah, and I was going to make a comment about if you're doing an in-person pre-employment exam, it's human nature that when we go into a situation where we're being tested and we're nervous, and you know, we tend to say things like, oh, I'm really nervous, or you know, I hope I get this right, or just as much as possible, less is better. Go in and act confident, fake it till you make it kind of thing. Even if you don't think you're going to do well, don't share that. Just be confident, go in, take it, and because your attitude and how you carry yourself plus how you do on the test is really what they're going to be evaluating. So keep that in mind. Sometimes we self-deprecate ourselves just to you know, be humble and that kind of thing, but in a job interview situation, you want to do the opposite. Just, you know, be professional, smile, act confident, even if you don't feel confident. You know,
That's
and
really important.
I think
Power of positive thinking, that's a thing.
Yeah,
it really does
definitely.
work. You know?
Definitely. All right.
Did we have any good questions come in?
There's some. I put them up on my computer. We're going to try and look at them and see if that works side by side. So on YouTube, LAJ483 asked, does the CCA have the same status as the CPCA? So the one I believe is an AHEMA exam and the other one is an AAPC exam. That's a very popular question we get. I would say it depends on where you want a job. I find that AHEMA, at least traditionally when I was, you know, doing a lot of one-on-one calls with students and people that were getting ready for the exams, that if you were going for a hospital setting, a HEMA was more respected. And if you were going for physician or outpatient, the AAPC was. Right. Now they've both kind of crossed over, and they both do a little of each, but one's, I think AAPC is much stronger in physician and outpatient, and there's many other organizations besides these two. They just seem to have a good foothold out in the industry, but there's new ones, and I would encourage people to be members of multiple organizations just to get your all your bases covered. I've been, a member of a HEMA and AAPC for, on and off for, boy, can't even remember how long it's been. But and it's not like you have to pick one camp or one team. You can be on both, and that's kind of nice. They also said it seems to me that AAPC is more popular than a HEMA. I think
that's
again,
a locational thing.
Yeah, it depends. I have found that to be the case, but my world has been outpatient and physician-based because I started off as an occupational therapist. That's kind of what I was kind of geared toward. I've always encouraged new students to go toward the physician and outpatient just because I feel that it's easier to get that first job. If you look in your local neighborhood, how many hospitals do you have? How many outpatient places and doctor's offices do you have? So it's just a numbers game to me. And that's just, I've always gravitated more toward the procedural based kind of coding, where Alicia's always loved more of the diagnosis based. So.
And now that so many remote opportunities are there that weren't there even like 5 years ago, even,
yeah,
that kind of changes the dynamics too, where back in the day.
Yeah, we sound really old tonight.
When you did, like I said, if you were going to work inpatient, they wanted you to have an AHEMA credential, and if you're going to work outpatient, you would have an APC credential. But now there's other credentialing bodies, and but those have been the one. AHEMA's been around since the 1920s. AAPC's been around since the 1980s, and there's been a dynamic shift back and forth. But if you go in with the attitude that this is the credential I have, even if, in my opinion, even if they say they want a HEMA and you have AAPC or vice versa, I would still apply for it and ask questions if this is acceptable, because sometimes the HR stuff's not up to date. Now, if you're working with a recruiter, though, whatever they give you is probably what they want, because a recruiter is, reimbursed to find the right people, the right fit. And so, if they say that they want you to have a HEMA credential, that means the people that hired them to find them a person wants an HEMA credential. And so, but otherwise,
I gotta turn off my notifications. Now everybody knows that I just got bowling shoes delivered.
I didn't see it.
Ay.
Yeah, that's funny.
Well, as you guys can tell, this is a very impromptu, informal chat.
Yeah, it's kind of nice. Let's see.
So I am trying to show the questions here.
We want to do a Facebook one now.
Yes. Okay. So I'm looking. It looks like Lori joined. Hi, Lori. Trying to think of it. Do I go up or down? Okay, so we go down. Let's start from the top. Hi from Maryland, Illinois. Hello all. They've taken both online and in person. That's Whitney. Okay.
Yeah.
So we should have interviewed her.
Yeah, you're right. She's done both.
Michelle said she worked up the ranks to coding in the facility. And that's what I find a lot in hospital kind of coding situations. People start in one department that's kind of related, and then they get into the coding that way. And really, the AHEMA exam for coding was designed for people that had been doing coding for years, and it was just for them to demonstrate that they had a higher level than maybe an entry-level person. But nowadays, a lot of people try and take that CCS exam to prove that they have entry-level skills, and that's why it's so hard to pass.
Oh, I like this question. I'm thinking about taking the CRC this year before I take the CPC, which I take next year, which is from Michelle H. I used to always say, no, you need to take the CPC first and then take the CRC. And then Laureen came up with some really valid points about the CRC, and it's a much better known credential. I don't know how to say that properly. Yeah.
You only need one coding manual.
And there's lots of jobs out there
initially,
for risk adjustments. So, anyway, I think that's a great thing to do. You know, it really gets your foot in the door. But unless you're always going to do risk adjustment, I would still pick up another more general.
Yes,
like
eventually.
The CPC. Yeah. But then you're already getting paid, so it gives you a little money in your pocketbook before you pick up that other credential. So that's really, really good.
Well, and Alicia was the one that she had actually done risk adjustment coding. And I remember, you know, years ago, her saying, this is the next big thing. We got to get a course together for this. This is the next big thing. And it took me a long time to really get my mind around how it worked. And then we were always saying, you know, get the CPC first, a nice general base credential, and then add on to it. But then when we realized people that were on a budget or they didn't have as much time, that with the CRC, you only were learning ICD-10, the one code, that diagnostic coding. So you could become really proficient at that. And then in time, add the CPC or whatever specialty you find you wanted. And also with CRC, of all the specialties, they tend to hire newbies remotely more than any other specialty. So there's a lot of pluses for starting with that. But we do recommend that you eventually add like CPC so that you can become proficient in CPT and HCPCS coding, or you know, the new QPro credentials that are out there. We're really pro for QPro.
Yeah. That made me think of something else too. Now, the advice I would give if you're wanting to do billing and coding, which are two fabulous credentials to get into, with that one, I would still take the coding credential first and then pick up the billing, because I think when you have that foundation of coding, you see some of the behind the scenes, the billing makes more sense. And so unless you've been doing billing, then take the billing credential first and then pick up the you know, the other. But because actually on the billing exam there's coding, and you know, even that small section where actually you're taught to code, it would be so much easier if you already knew how to code. Then that's just, you know, extra chapter. So that's my thought process. Michelle said, what are your thoughts on that? Let's see. And maybe a 2-year get cancer certification. Do they all work together? Now, cancer certification, if you mean oncology specialty, yeah, that would be fabulous. However, if you're talking about tumor registry, that's a different type of certification. It's really, really interesting, quite fascinating. The study is a little bit different, but they've got study guides. It's the SEER. I don't know how, I don't remember what the acronym stands for, but that would be something that I think would make you extremely well-rounded to if you pick up that extra and get tumor registry as well, because we know cancer is not going away anytime soon.
Normally what happens, you kind of get that first job. Once you get your first credential, you get that first job, and life will steer you, you know, where you should go get your next specialty. You don't have to figure it all out at the beginning. And you have a resource in CCO. You know, we have a help desk. If you're a club member, you know, we'll certainly help give you some ideas. But you're going to find out that life is actually going to take you on that journey. Once you put it out there that you want to be a coder, that you want to be a biller, what resonates with you, it'll all come together, you know.
And even when you're a student too, there were two ladies that were friends, and they took our course a few years ago. And they both, one loved orthopedics and the other one loved cardiology, they thought. And then when they did those chapters in the PBC course that we have, they said it was almost freaky the way they completely switched. I mean, they could have been any subject, but they said, I was doing cardiology. I never thought I would like that. And she goes, I fell in love with it, and that's what I want to specialize in. And the other one said, she goes, I never wanted to do orthopedics. And so again, your education whets that whistle where you think, you know what, I don't like E&M. I don't like CPT. I really like ICD and the disease process. And then you go in and say, no, I really like the leveling. I love the procedures and what you do to the patient versus having to know, so again, it works
So
its way.
Retha is asking, how do you choose your software? And then she clarified your medical billing software. So if you are trying to set up and be your own billing company, I would direct you to AMBA, the American Medical Billing Association. The folks over there are great. They're super supportive. They can give you some great advice. I know if you're just trying to do it to learn, there's several free ones that you can download a demo to be able to get a little familiar with it. There's pros and cons to all of them. So we're not experts in medical billing software. We try and teach you how to do medical billing and all the different kind of fields that you'll find in any software that you end up using. But I would check out AMBA, and I'm not sure what the latest and greatest is. I know I used to use Medisoft, I used Litech, and they both had their pros and cons.
The college we trained our students in Medisoft at the time, but that was a while back. And now there's so many programs out there that you can have a great program and specialize it to your needs and or who your clients are. So, but another thing about AMBA, they came out with a coding credential recently, but you never can steer. That is their world. Billing is their world. And those are people that if you want to, a lot of the members are billing owners, company owners. So that would be networking and resources. Man, that they're going to be the ones that are going to, you're right.
And then Cynthia asked how to become familiar with an encoder prior to an interview or test for coding. So I would, ask them ahead if you're going to be required to use an encoder, and if so, what one do they use? Many of them have a free demo period. I know Find a Code does, that's our preferred one. I believe all of them out there. So whatever one they tell you, go do a quick Google search and look for demo or free demo or something like that. And then you download it and you play with it and get familiar with it. Do a YouTube search on that software. You'll probably see people demoing it and how it's used. So, that's the best way, to do it. But you got to know what one. Yeah, you got to know what one. Andrea, is that AMBA? Yes, AMBA. I think it's ambanet.net is their URL. Let me try it here.
I know it's net. It's not. Well, really good organization.
ambanet.net, I think.
And the Facebook, I'm looking, let's see. While you're looking at it, Elsa Brown says, Lori, this impromptu thing is wonderful. I'm at the Rolling Stones concert listening to the webinar. I try to get them in anytime, anywhere. Now that's commitment. I don't know how you can hear us through the Rolling Stones.
I can't believe you want to listen to us over the Rolling Stones. I know. But thank you, Jenny. We appreciate that. I guess you can't get no satisfaction. Great questions. LAJ, what is your first name? I feel funny calling you LAJ483. What is an effective way to memorize codes, or is memorization not required? I don't feel you have to memorize codes. I thought the same thing when I first went to sit for the CPC exam. And what I learned really quickly is that I needed to know how to look up codes quickly and to compare and contrast the codes, because on most certification exams, they're giving you multiple choice. They're giving you, 4 ABC answers, and then in each answer, they might have 2 or 3 codes. So what you need to do is look up those codes and see what the difference is and see which one fits your question or scenario that they're asking you to code. So, but that being said, there are some little things that help, like with ICD-10. If you know that all ICD-10 codes that start with an I are for what system, Alicia?
Cardiology for ischemia.
Cardiology. You start to learn all those things that if someone just plunked down a claim form in front of you and you saw what codes they started with, you could start to piece together the picture. Oh, okay, this is a derm note, because I can see the CPT code is from the skin category, integumentary, and I can see this diagnosis code is from, so that kind of stuff is a little helpful, but I would not try and memorize codes.
No, I mean, you'll find when you're working, because of certain specialties, there's repetitious. I mean, we all know I-10, right? We usually all know what diabetes type 1 and type 2 is. We may not remember the ones that have comorbidities. It's like, oh, it's E11 point. Which one was for eyes? That's okay. There's two things I would say to that. One is you just need to be aware of the existence of certain codes. I think that's where you trip up, where you get in a routine and you start using codes that end in 9. They're, especially with cardiac conditions, the person may have CAD, but quite honestly, CAD is not the proper code usually, especially if they see a cardiologist. Then they're going to want to know, is it with systolic or diastolic problems, or both, systolic on diastolic. You're never going to have that just CAD code. It's going to have a higher specificity because you're seeing a cardiologist and they can tell. So you don't want to get tunnel vision and memorize a code and then there be other codes available that have a higher specificity. And that's why plus they change every year a little bit. The other thing is, and I've seen this with when you're teaching students and you want them to use the index, because what do we do after we've been doing it for a while? We think, oh, well, I know that's an E11 code because it's, type 2 diabetes. So I just flip over to the tabular and go straight there. But the problem is the index is literally your index. And it may say, oh, but if you have this particular type of diabetes, it refers you to something else, not where you would think that you go. And you have to trust the index and the verbiage that it uses. So it doesn't happen very often, but I think it's more important to be aware of codes, both CPT and ICD. And I tell people, just do a little light reading. Flip when you find a code and you have time, look at the codes above and below it and the page before and the page before, and say, I didn't even know there was a code for that. That's a good thing. Just be aware. And then when you see that term or that verbiage pop up, you think, hey, wait a minute, wasn't there like a specific code when this scenario happens? Yes, there is.
And that's why we like the BAT technique, because it makes you get really familiar with your manuals.
Up close and friendly.
Okay, so let's see. What does it mean when the claim comes back and says it's inclusive? So in procedural coding, CPT coding, you sometimes have like a parent code and it includes other lesser codes. For example, an oophorectomy, removing an ovary. In order to get to the ovary, you have to do a laparotomy. You have to open up the abdomen, unless it's laparoscopic. But so that approach to get to the ovary is included or inclusive in that oophorectomy CPT code. So if you put two codes and one is included in the other, you might get that message saying that it was inclusive.
This is a good question on Facebook. Jenny says, I've been coding for hemo-oncology and rheumatology office for inpatient hospital coder for 2 years. Now I've passed my CPC. What do I need to do to turn over the APC and get that A taken off? All you do is you get your employer to write a letter. No frills. Just say that you've been working for them from this date to this date with using ICD, CPT, or whatever code sets you use. That's all you need to do. Send them that letter on letterhead, and they'll knock it off for you.
And short and sweet. They don't need a whole, and they're a wonderful employee, and it's not a reference letter. It's just someone of authority is confirming that
Yeah.
you are, you know, actively using, you're actually, you know,
code
coding. Yeah.
There, let's see. Whitney says, can you talk a little bit about type 1.5 diabetes? That's a funny story, and I can, but I can tell you there is going to be a code for that soon. It's if you guys didn't know that there was a type 1.5 diabetes, it is. It's got a special name, and it's people that you have to know about diabetes to understand what's the difference between type 1 and type 2. It isn't just the fact they use insulin, it's the way the body reacts. And what happens is the person is a type 2 diabetic, the way the body reacts to insulin and stuff, for about 15 years, and then they turn into a type 1 diabetic, which doesn't mean they're just insulin dependent. It's the actual chemical makeup of the way the diabetes works. And so it's much more mainstream now. You hear about it. I've met several people when I've done lectures that actually have it because I talk about it. And it's really, really cool. So we did a video, I think, about it before. You can go look at it on the YouTube channel about 1.5 and learn more about it. But I encourage you to go Google it and do some studies on that. But it doesn't have a code yet. You can code it as other if you want to, but there is not even a coding clinic on it yet. So I would just query the provider and say, do you want me to code it as type 1, type 2? Or these are my choices. Which do you say that it is the closest to? So that's what I would do.
And I'm putting a link in both chats for the A removal from AAPC. So this page will tell you all about say goodbye to your A. Tells you how to do that.
Yeah. P. Myers asks, an aspiring coder with no experience, would you pursue billing over risk adjustment? I'd rather be doing the coding side than billing. Okay. The facts are billing jobs are more prevalent than coding jobs. I don't know why there's more of a turnover. I don't know. Probably because I don't like to do it. I can, but I shouldn't say that, because like Jennifer that works with us, she loves it. And I know I have friends that actually love billing and don't like the coding aspect.
Mm-hmm.
What I would do is just look for the jobs, see what's out there, because if you need to get your foot in the door, if you want to work in a face-to-face office job, you're going to get a billing job. A few risk adjustments in-house are out there. They are out there, but usually they're going to be people that are coders that work there that transfer over to that. And then, but if you want to work remote, you push for getting on with agencies that do risk adjustment. And there is a lot. Get on LinkedIn, let them know you're doing, the keywords are not CRC, they're not HCC. The keyword is risk adjustment. I want to do risk adjustment coding, and just wait and see which job you get first, because you can start out in billing and move over sometime.
So, all right, let's see what else we've got here.
Retha asked a question that we have lots of videos on. Retha says, how do you tell when you need to use a modifier? Well, Laureen is like the queen of modifiers. And
yeah, you basically have to know the menu, right? You have to know what modifiers are available. And with the CPT modifiers, there's not that many. We encourage our students to memorize those. So don't memorize codes, but memorize your modifiers, because there's just a short little group so that as soon as you see it, you know exactly what it's for. The other thing we recommend is learn your modifiers by family or type. And we have a whole modifier presentation that goes into that's available to our club members. That I think that's available in the club, right? Modifier presentation.
I think so, because we had talked about it a while back, and I think Jesus made sure that it's in there.
Yeah, I mean, it's part of our
course. It was one of our.
But I believe we made it available to our club members. If not, I'm gonna today, because I just opened my big mail. So, but
and the modifier
to learn
that
it by
you
family.
created, I think that might be in our freebies because they'd have to look.
Check.
But
Let me check.
Lauren created this modifier grid that we used to give out when we went to conferences and things, and it's I mean, people snapped it up right and left because modifiers can be intimidating. And you know, even for people that code all the time, the modifiers, if you, in my opinion, if you get your billing sent back or whatever, a lot of times it has to do because of a modifier, you know. And this modifier grid was just brilliant, and it divides them up into the with arrows to say, you know, this is going to increase payment, this is going to keep your reimbursement the same, this is going to decrease reimbursement. If you know that, the modifiers make sense. Why would you append this? Because they're doing 2 procedures, and we're not going to pay you full price for 2 procedures when you're already in there. That, you know, it just makes sense type thing.
So if you go to cco.us, guys, in the middle menu bar, it's the very first one with a green heart, freebies. Just click on that and you'll see there's a whole bunch of stuff that you can request. You know, we have a monthly webinar that we do. We've got our newsletter that you can join for free practice exams. That's always nice to know if you're ready. And then of course we've got paid ones after that if you need more. How to become a certified medical coder, how to prepare for your first coding test, how to get started. Did you fail and now you need a retake strategy? What one was I looking for? Here it is, CPT modifier
grid.
This one here. So you just click here. It's going to say click here to download, but we are going to ask for your name and email. You know, that's how it works. Got to give us a little something to get something free. And then we'll email it, you know, to you. But I'm going to see if I can find it while you're chatting.
Michelle Landis says, I downloaded the modifier grid from CCO. Great tool. Thank you. And then Andrea Aguirre, I may have tortured that last name. She says, yeah, it's in the free tools on your site. So they already know they've downloaded it.
All right, we'll find it. I just wanted to show it on the screen.
Well, we've had it for a long time, and I think it's probably one of the best tools that you can. It's something that you can keep on your desk. You know, it's printed off to where it, you know, you put it where you can flip it over. You can get it laminate it, you know, or put it in a sleeve. And modifiers don't really change, you know, so the information's just as good now as it was, you know, if you picked it up from us when you saw us at one of the conferences or something.
But I really had the same question. I'm like, okay, I get that there's these modifiers, but what's my trigger to know when to use them? And so I finally came to the conclusion that I had to understand the general circumstances of when you would use them. And the biggest is when there's multiple surgeries. Okay, you got to tell that, you know, story. And that goes along with the inclusive thing, you know, saying the laparotomy is inclusive in a oophorectomy. But sometimes there's a situation where you do both. I had it happen to me. I had my left ovary removed, but then I had some bleeding or something going on, and they had to reopen me. So they did the original laparotomy, but then they had to do a second one to go do like an exploratory to see what was going on. So in that instance, they could bill both, but now they have to tell the story. Okay, I know this one's normally included in the other one, but this modifier 59 is telling the story that it was done separate from that first procedure. Now, you know, with modifier 59, it's the modifier of last resort. So if there's another modifier that could tell the story, for example, if it was done on a right and left side, and now you're trying to say it's on the opposite side, then you can use an RT or LT modifier. But that's the general concept. Modifiers help tell that story more accurately. If no modifier can help tell your story more accurately, then you don't need one. So, and the good thing is for
it's like
board
when
exam,
you paint, it's the highlights.
Yeah, and when you are taking a certification exam, most of them are multiple choice. So modifiers actually become your friend in helping you do process of elimination. So if 2 answers have a modifier and 2 don't, Well, that's the first thing you figure out. Do I need a modifier? And if you do, then you can throw out the other two answers and focus on, you know, those two to see what the other differences are.
Yep.
That's not what I was looking for.
That's good stuff. See if there's any. Oh, here's while she's looking that up, Vicky asked, if you have a CPC and a CCS, do they have CEUs that you can take that would cover CEU requirements for both? Yes, they do now. In the past, you had to get approval, you know, so like if you had an AAPC one, you had to submit for approval, but now the verbiage has changed, and if they accept each other's CEUs. And so, yeah, you just have to submit it. The main thing that you have to do when you submit CEUs to your credentialing body is to the name of the whatever you sat in and watched, the date, and how many CEUs that it was giving you, and then all the entities give you a CEU number to file. So. And now, I don't know, I think AHEMA has an app, but I know AAPC now has an app where you can load your CEUs. So you can like take a picture of the paper and load it. So I haven't used it yet, but.
Are you seeing the grid?
Nope.
Not yet.
No, maybe just as a little delay.
Yeah, I'm noticing my internet is really slow.
There it is.
And there's been some
popped
weird
up.
internet stuff going on the last couple of days. Today I tried to post a picture on Facebook, and it's like the pictures didn't show up, and then Jesus was saying,
Facebook
oh yeah,
and
it's a big issue.
Instagram I bet it broke the internet. Everybody's like bombarded. Imagine that.
So this is the modifier grid that I came up with many years ago. But the general idea is
She used to print it out on this pretty green paper.
Yep. Grouping them by family. So, you know, is it a global package modifier? Is it related to a bundling or CCI issue? Is it for E&M only? Is it related to the number of surgeons? Is it an anesthesia modifier, a lab modifier, and then all the rest that didn't quite fit into a family? So you can see here, global package modifiers is the biggest family. So if you aren't in a global period, meaning there's been some sort of surgery and now the visits after, the follow-up visits after are considered bundled in to that surgery code, now you have an exception to that. So you've got another visit to bill for that isn't really related, or it's kind of related, but there's some nuance that you need to tell the story that I really need to be paid for this service because it's not part of that original bundled kind of CPT code. So once you determine
or done a clerical area.
Yeah, that's your situation, then you just shop this list of global package modifiers. Which one applies to your situation? Is it you're trying to say, because this one's, you'll notice it's global package and E&M for 57 here, you know, then you're telling the story, oh, that E&M was the day they decided to do the surgery, so it shouldn't be bundled into the surgery code. Is it a stage or related procedure? Well, then that's 58. Is it a repeat procedure? Then it's a 76, so on and so forth. We're not going to go do a whole modifier presentation, but you get the idea.
Though.
Yeah, does
the
it make
arrows to me? They just make sense when I look at the arrow.
And I'm glad you mentioned that because I forgot about that. That is what helped me initially as a new coder to get it. Like, what's the purpose of the modifier? Is it going to make the money go down? Is it going to, are you expecting the money to go up because applying the modifier, or is it just informational? And sometimes it's more like a key. It gets the claim considered, and that's a big thing with the global package modifiers. If you don't use any modifier, then the claim's just going to be batted back at you. They're not even going to consider it. So at any rate, go request this, and hopefully it'll be helpful to you. And join the club. Watch the video presentation that goes along with it.
Yeah, it's a good one.
Patricia, I
We've
am
done
a
good.
CCO member. How do I access CEUs? Best thing to do, Patricia, is open up a help desk ticket and they'll get you pointed in the right direction. Mostly though, when you log into your membership area in Podio, you should be able to see the educational events that have CEUs attached. If you need a little help figuring that out, ask in the help desk and they'll probably point you to a FAQ that we've already developed on that.
Going back to the slide deck, since we're about 10 minutes till we end, we also put on there, what do you need to take to your interview? That question had come up a couple times in our social media. We already mentioned your manuals. You know, you could always have them in your car if you have to and say, oh, you know, because they may ask if you're willing to take the exam now. Probably not going to do that. But, you know, what I would make sure that you have in your interview is, of course, the manuals, if you think you need them. You need to probably have another copy of your resume, even though they should have a copy of it. It's just a nice practice to have that there. And also, it doesn't hurt to, if you have it, maybe a letter of reference to also have in your stash or something. If you're a new coder, you have to validate yourself. Now, it's different if you've been out in there, but kind of thinking of a new coder perspective. And a letter of reference, especially when you do your applications, you don't want your mother's best friend, you know, because she helped to raise you or whatever. You need professional. You need your educator. You know, they used to say, you know, you could use your pastor, but quite honestly, what can they tell? Okay, well, you go to church, but it's supposed to be morality or something. But no, you need professional. You need the person, an instructor. You need somebody that you've worked with in the past, a supervisor, and things like that. So you know, maybe even additional letter of reference. What I would consider taking too is, if you know you want to work at a specific facility, print off some information about that facility and kind of scan it before you go into the interview, so that you can articulate that you are you're very interested in them. Like, oh, I heard you just got a new cardiologist, Dr. Sanchez, isn't it, that I saw on the website, and that you're expanding your cardiology wing. I am particularly fond of coding cardiology, and so that's another reason why I would really like to work here. Or, you know, because they're always doing information. So maybe print something out, or even look on your phone right before you go in and look at their website and see what their announcements are. You know, but otherwise keep it very minimal. Don't take a big bulky purse. You know, we've talked before about, you know, what to wear and stuff like that. Can you think of anything else that you might want to take?
No, we talked about the manuals. That's really the main thing. Your own what?
Yeah. Ink pen.
What did you say?
Someone told me one time,
your own pen.
your own ink pen. Yeah, and they said it's because it gives the impression that you're always prepared. I'm like, oh, okay. And if you ever see trash on the way to the facility that you're working, you always pick it up. Because there was that guy that talked about he hired because nobody picked up that wadded piece of paper, but one person did, and he said, I knew that they would take care of the, you know, anyway. Be very aware when you go in, preparing for a job, that of all of the people, and like I said before, that presence that you exude, that positive attitude, that confidence. You don't have to be cocky. You're being confident and eager, but not, you know, don't overdo it, and an air of professionalism from the person that is standing at the door to the person at the receptionist usually gets asked about the people. Everywhere I've ever worked, they've always gone and asked the people up front, what did you think of so-and-so that walked in? You know, it's like, oh man, she had so much perfume on, I could hardly sit in here with her, or, you know, or she was on her phone the whole time, you know, things like that. So
that's another good point, is don't be glued to your phone. If you're in the waiting room or whatever, just sit don't like be constantly checking your phone, because they're going to think you might be a problem employee that's going to be getting on social media during work. So I know it'll kill you. I know it would kill me, because I'm always trying to keep
That's
my
the other
mind
thing. Turn
busy.
your phone off. Yeah, turn your phone off. You know that you do not want it going off or making beeping noises or anything while you're interview, because they want your undivided attention. This was never an issue back in the day. You know, you never had that, but
times are changing.
So
Whitney's asking, what do you all advise on jobs that require you to put your desired salary range? Put your desired salary range. What do you want to make?
Yeah.
You know, if you put something low because you want the job, well, that's what they're gonna offer you if they like you. If they really like you and you've got all the skills. I mean, obviously you're not gonna, you know, put, oh, I want to make $50 an hour. What I mean by put down what you really realistically, based on your research, getting out on the internet, looking at what the newspapers are saying they're hiring for, you have an idea of, you know, what you're worth as a new coder. Or if this is a second or third job, then you really know, because you've been in it. But don't undercut yourself, because what'll happen on the next job is they're going to say, what do you currently make? You know, which, yeah, I mean, I don't believe there's any,
I make $1 billion.
Yeah, employers that would confirm what someone made with them. So, you know, you could even put what you want to make, you know, and they're going to look at it. If they really like you, they're going to come back and say, we really like you, but, you know, what you want to make is a little more, you know, do you have any wiggle room there? And, you know, you could say, well, what's the path for, you know, salary increases in the future? Is it something that would be years down the road? Would it be 3 months? And then they can see you're being reasonable. And then what if they're offering you something, say, no, I think I could, you know, make that work, because I really like the atmosphere here, or something like that, where you're saying there's some other concession, or maybe you didn't realize they had as many vacation days as other companies you were considering, something like that.
Or the health package or something. The students in the past, we used to instruct them to say things like, I'm sure that whatever you're offering is you know, fair for this market, or I'm sure that now that you've seen my skill set, that that whatever you're offering will be fine. And that opens the door for them to say, oh, well, we're offering, you know, $19 an hour, or we're offering, you know, whatever. And he's like, oh, okay, because you were thinking I'll be happy for 10, you know. And so yeah, you could don't go too high and don't go too low, but that's doing your research, right? Go to and ask the other people, you know, what would one expect to make? Not how much do you make at your job because I want to work there. No, how much would one expect an entry-level coder to make at that facility? And they can say, oh, well, when I started out, I got paid X, but I've been there for 5 years. And, you know, it's like, oh, okay. You know, that's a good way to say it too. Yeah, we do letters of reference for people that did our courses, Linda.
Well, it's not really a letter of reference. It's a letter confirming that they completed the course successfully. So it's not the kind of letter of reference that an employer wants to indicate your work ethic, your work skills, that kind of thing, unless you were you know, a special case, like a, you know, coaching case where, you know, a lot of time was spent with you or whatever, that might be a little different. But you do get a letter from us when you complete your course, because we really can't speak to how,
if you're going to show up to your job.
Yeah, you know, some of the questions that an employer would know about your work habits. I mean, we can say, yeah, they worked hard and they got good grades and they passed their courses, but, you know, most of our courses are at your own pace. So, you know, maybe you took, you know, 16 hours to complete a module to someone's 8. So, we don't know that. We don't watch how long, you know, you take to be able to speak to those kind of things. But if we've had some personal interaction with you, like our interns, we definitely do letters of recommendation for our interns because we work with them. We know their work ethic. We know how hard they work. We know how well they follow through on instructions and that kind of thing. So.
And bring ideas to the table and stuff. Yeah.
We love our interns. Thank you guys.
They are good. We did good. We're on the hour.
Is it an hour already?
We did good, guys.
Oh, yeah. All right.
Hey, if you guys know of a topic that you would like us to do in these live, and again, these are casual, right?
They're not deep dives into coding
things.
questions.
This isn't. Especially like the behind the scenes. If you want to pick our brains or learn experiences we've had, things like that, much more down to earth, less formal, then by all means, let us know.
And we're really
we'll talk
counting on our tribe to help us, you know, get the word out, let people know that you appreciate CCO, tell them to check us out, check out the club. You know, that's really what we want, is to get more exposure by doing this. And we love chatting. We love kibitzing and getting in front of the camera, quite honestly. Me and Alicia, at any rate, some of us are a little more shy at CCO, but a lot of people behind the scenes, you know, the people that are
make
working
us look really good
for CCO, they love it. We love what we've created here, and we want to see it grow. And the way to make it grow is through word of mouth referrals, and that's how we've gotten to where we are today.
Right.
So thank you very much.
That helps if you like and subscribe on our social media, share it. If you're on LinkedIn, you might let people know that, share one of our videos on LinkedIn or on your personal Facebook if you have other people that are coders, and that would be really helpful. That speaks volumes to do that.
And we're having a special right now, 25% semi-annual sale, 25% off courses and blitzes. And I think this one, what we did special with this is that I believe it's like almost our entire catalog. So we don't normally do everything like this. So check it out. But make sure, if you are going to take advantage of this, that you go to this page, the one where it says, you know, click here, check out the sale, because there's special buttons here that the discount is attached to. If you go to our regular sales page, you're going to get the full price. So here, like our physician-based coding course, you can do one payment of $12.59 or 4 payments of $346. The regular price is $16.79, so that's a really good savings there. So, but if you want to check out the full sales page, just click on the Learn More, but don't purchase on that page. Make sure you come back here to purchase to get the discount.
That link, and if you have somebody that you know that is thinking about taking some courses, that's something that you could share that link on your social media. We'd appreciate that.
Very much so. So do your homework. Go share those links. All right. Thank you, Boyd.
You betcha. Thanks everybody for joining us here tonight. Happy 4th of July for those of us in the US. Happy Canada Day that's just passed for those of us Canadians masquerading as Americans.
I got a call from a Canadian. It came through and I thought, why are they thinking, you know, that I would be available right before the 4th of July? And I thought, oh, well, because they have no clue what 4th of July is. That's why.
They have a clue. Canadians are very smart.
We are.
Oh,
all right.
I guess.
Thanks everybody.
Bye. Have a good night.
Bye, guys.